medicine is a lifelong endeavor. Most people in medical school are competitive people. Getting into medical school, most people want to be the best graduating students. How much healthy competition do we actually have? Most part, I think, is just toxic competition that's in medical school in this country.
Hi guys, welcome back to my channel. My name is Soma. I'm a fifth-year medical student in Nigeria, and in this video today we're talking about academic excellence in medical school, but we're talking about that with someone who is well versed in academic excellence in medical school.
Hey guys, my name is Dr. Tochi, and it's my pleasure being here today.
In this video, Dr. Tochi will be answering 10 questions, and these 10 questions are from his personal experience in medical school based on academic excellence. So the first question is, what does academic excellence mean in medical school? Is it just about grades or is there anything extra?
Objectively, academic excellence is actually about grades. So how well you do in your exams, getting distinctions, but on a more individual level, um, doing better than you did in a previous class, getting yourself after a receipt, just pushing yourself that extra mile to do better. I think that can also stand for academic excellence.
What you're trying to say in essence that it's all about grades,
Yeah, it's just all about
but it doesn't
academics.
matter if you are failing as long as you're able to come back to your feet.
Exactly. Yeah.
Okay. So the next question is, what role did failure or low scores play in your academic growth?
Well, I remember my preclinical years. Then we were still doing the semester system, and most of our exams were essay based. So I wasn't really, getting A's then. Most medical students strive to get A's, and that's above 70. Well, back then, I would, especially for anatomy, I would read so hard, and then we would take the exams. And then when the scores would come out, I even had the A, C once. With each result I saw, getting C's, getting B's, I wasn't getting the A's that I worked towards. So what it did to me then, it just sensitized me. So I stopped looking forward to grades. I just started reading for the sake of knowing, because I realized that if you attach your career as a doctor, career as a medical student, if you attach your purpose to just the scores that you get, then it can be heartbreaking, gut-wrenching when you don't get the results that you desire to get.
What study method helped you to perform well academically under pressure? Because there are so many study methods, but which one did you personally use that actually worked for you?
Okay. Starting medical school, I struggled finding my feet, finding the perfect method that would work. There are different study methods. Best method I feel that every medical student should imbibe is all or none. Okay, all or none. What do I mean by all or none now? Because of the vastness of the courses that we do, the vastness and complexity of the content. Study methods like the Pomodoro technique is it's not really effective. You saying, okay, I'm going to read for 30 minutes and then take a break for 5 minutes and then come back again, read for 30 minutes again. It doesn't make sense. If you're going to read a course, okay, most of our courses and almost all the courses you'll be doing from anatomy, biochemistry is really grouped in systems. So if you're going to read a course, I think it's better you just take a part of that course. For example, now if you're reading physiology and want to do cardiovascular physiology, I think it's better to just go all out, time yourself, maybe 2, 3 days, read up cardiovascular physiology, all of it, all or none. Just go through it once, intense. Now, the aim at first of your first contact with that course, with that topic, is not to get all the information or understand everything, but just go through it once so that you know, okay, I'm done with this. And then what you now do is, by the time you're done with that topic, you now come back to it in bits. So I think that's the best thing that worked for me.
From what you said something about cardiovascular physiology, all those ones that have systems,
Yeah.
and this is only applicable in pathology, pharmacology, anatomy. But when it comes to O&G, pediatrics, is there something like
Yeah,
that?
for pediatrics, it's also organized in systems. So hematology, cardiovascular, neurology, community pediatrics. O and G sharp is not exactly organized in systems, but there's the obstetric part and there's the gynecology part. So you can take down the obstetric part that's dealing with women when they are pregnant, and then take down the gynecology part. It's a lot of work, and for a course as big as O&G, you don't need to do all of it at once, but you can split it. The aim is just to try and cover everything at once first. It's a lot. It's intense, but you just do it first, so you have that first contact with the course.
How did you approach clinical rotations to stand out academically?
Okay, okay. For clinical rotations, what we've been talking about so far is mainly for your theory exams, so for your MCQs and your essay. For clinical rotations, I think that's a different ball game because first of all, if you should have a group. Okay, personally, I started taking group study seriously from 500 level because that was when we started doing our OSCEs, that's the clinical exams. So you need a group. You're going to collect, you're going to examine. So what you need to do is practice. You have the manual, you have the um, checklists. So what you just need to do is practice, practice, practice. Clinical exams is just a test of who has practiced the most. Yeah, so repetition breeds mastery. Just over, if you're going to do your cardiovascular exam, get a group, two, three people, you examine yourselves. What I did back then was in the morning when I wake up on my own, I would just set my pillow and then examine, just do maybe one system in the morning. And then in the evening when I meet with my roommates, that's Maga, when I meet with him in the evening, we just do another system. So we've done one system in the morning, one system in the evening, and it doesn't take much time. 10-20 minutes, you're done, the both of you. Then you do that the following day. Now, if you do this every day, imagine how good you do this. You correct your mistakes, you take correction, you apply it the next time you examine. You do that on Monday, do that on Tuesday, do that on Wednesday, different systems. Do that every week, 4 times, that's 4 weeks a month. When you get to the exams now, any station that has examination should not be your issue. Same thing with clerking. Don't run away from patients. If you go for your clinical postings, walk up to the patient, clerk. It's just a matter of repetition. Ask the biodata, collect the condition, rule out causes. The truth of the matter is that clinical part of exams, the clerking aspect, the examination aspect, is not something you should just sit down and read up. It doesn't work that way. Ask those questions, present to your consultant, present to yourselves even. Let people make corrections. You get better each time you do it.
What is one habit that significantly improved your academic performance? Like when it comes to routines, like what was one habit that helped you?
Okay, one habit. Okay. I think one habit that significantly improved my performance was doing past questions. Okay. Now, for the most part of my medical school, I was just reading up, trying to cover the scheme. When I cover the scheme, then I will now, and sometimes I enter the exam hall and I've not done any past questions at all. Now, it's not bad, and I'm not saying you should do past questions in isolation, but past questions are important, not because you're expecting them to repeat the questions, but because answering MCQs, answering exam questions, it's an art. It's different from you knowing the stuff. You can read up the course content, have all the information, have all the stuff, but delivering those, putting the stuff down on paper during the exams is a different ball game. And I wouldn't advise any medical student to just solely do past questions.
How did you handle comparison and competition among your high achieving classmates or colleagues?
Okay. Competition is normal in medical school because most of the people in medical school were top of their class for the quarter admission. So most people in medical school are competitive people, at least initially, maybe from 100 level, 200 level. before people start to find their way. People will develop other interests along the line, but most people in the class, I know, getting into medical school, most people want to be the best graduating student. That kind of vibe. Yeah, so competition is not bad in itself. I think it's even good because when you compete, you push yourself to do more, to climb higher. You leave your comfort zone, that kind of thing. But then, how much healthy competition do we actually have? Well, whatever I'm saying is from my personal experience. So, but what we see is people hiding materials. You really want to share a material that you have, a material that you know that okay, this can actually help my classmates. You wouldn't want to do that. You just want to keep it to yourself so that you have an advantage. So competition in our setting now kind of breeds resentment. Okay, you don't want this person to pass. You're not. If this person eventually passes you, you're not satisfied. That kind of thing. You get angry. It takes a lot of maturity to let go of competition. And though it's not easy to have that intrinsic motivation unless you have developed it. If you catch yourself, you have a material or you have a textbook and then you don't want to share this textbook, if you catch yourself doing that, I think you should just send the textbook, let it go, intentionally let it go. You don't feel good or you feel inferior when you see your classmates passing you. It's a normal human feeling. Don't let anyone beat you into say you're a terrible person. No, no, no. It's normal. But what's important is how you act on those emotions. This is just for 6 7 years. Medicine is a lifelong endeavor. You're going to be alone for the most part of your career. Yeah, so it's one downside of competing with others is your benchmark is passing that person. So if that person has a 50, you just want to have a 51 and you're okay. Competition has its upside, downside, but for the most part, I think it's just toxic competition that's in medical school in this country. You are hiding materials, you are, scheming to pass the next person, scheming for the other person to fail. It's terrible. So detach yourself from it.
What mindset helps you to move from just passing exam to actually excelling?
Okay, the mindset that did that for me, like I said before, I detached myself from exam scores. That's one. The next thing is that when I eventually had my first distinction, in fact, in my pre-clinical years, I went for the three distinctions. What hit me was I'm just a regular person. So people that have been having these distinctions, the best graduating students, there's a way people see them. You just see them as this person must be so intelligent. He must be doing something special. He must be, oh my goodness. Then you must be blessed. When I eventually had my distinction, the first one, and then subsequently more started. At the point in medical school, it became a norm for me because every course I was doing, I was looking forward to a distinction in that course. If it didn't come, then it will most likely be because of my circumstances, not because of I couldn't get it. Probably the system, the way the system is structured and all. And that's just how it became for me. People think I'm special. I'm not special, though, just regular. But I just realized that okay, this is the amount of work I have to put in to get a distinction. I have to start doing that work. It's all in your head. It's crazy how a thought can be so powerful. People don't know how a thought can be so powerful. You think about it, you hold that thought in place, keep on looking at it over a long period of time. You make actions every day. All your actions are geared towards it. You can get it. Getting a distinction is not rocket science. I can bet you that almost every medical student knows what it takes, maybe except the 100 level students who are just coming in. But at some point, 200 level, 300 level, after your first MB, everyone is aware what it takes to get a distinction. You know the amount of work you have to put in. You know the sacrifices you have to make. But how many people are willing to make that sacrifice? Not many people would want to, cover the course content. You can imagine how broad our scheme is, and then you're reading everything. You want to be that is not just you are reading everything, revising it again.
How did you transition from memorizing information to actually applying them clinically? Like now, as a doctor, you have to apply those things you've learned. So, how did you transition in your 600 level?
Okay.
That kind of thing.
Okay. I think the transition even starts from 500. Yeah, well, one thing is you can't be a good clinician without having knowledge. Profession is so heavily dependent on how much you know as a doctor, whether you're a surgeon, a doctor, whoever you are in this field. It's heavily dependent on how much you know. So transitioning into the clinic, applying the knowledge you've gotten, you can't apply what you don't have. First of all, this patient has come with chronic cough, has come with fever, has come with weight loss. You want to know different things. If you don't know that, okay, malignancies can also cause weight loss. If you don't know that, okay, COPD can also cause cough. If you don't know that, okay, malaria can cause cough, pneumonia can cause cough. You can see that I've just mentioned some other diseases that can cause cough. That is what will make your clicking meaningful. The more you know, the more you're able to diagnose from your history taking. So the more you know, the more you're able to apply clinically. If it's just a random, because anyone can learn clinical skills. If I bring someone who did not go to medical school, keep them in the hospital for a year, they will have the skills. They will be able to set line. They will be able to examine, they will course and then give you findings. But then they will not know the pathophysiology behind it. They don't have that background knowledge that a doctor has. So transitioning from reading books, reading your textbooks to the clinic, first of all, you need to be proficient in your theory. Have a good understanding of the theory first. It makes it somewhat easier when you're now applying it. Because if you can't understand, you can't apply what you don't know. If not, you just be learning it like a will I say a skill, but then you need to know the reason why they are doing this. Why are they telling the patient to turn over? Why are they telling the patient to inhale?
From your own perspective, what mistakes do you think that medical students actually make that hurt them academically?
Okay. And the first mistake that most students make is not starting on time. Okay, you just wait till you have a test before you start reading. Okay, that's one very common mistake. You need to start on time, start reading on time. Uh, the second mistake is skipping classes. Okay, in as much as you want to, there's a host of resources for you to read from, different textbooks, different lecture videos. You can learn medicine on your own, at least the theory aspect. There's a lot of resources on the internet, but then you need to attend classes so that you get your lecturer's point of view. The lecturer are the ones setting your exams. You need to know their thought process. Another mistake is not doing past questions. Last common mistake among um, medical students is in the exam itself, during the exam, time management.
Okay, so the first one you said like starting on time. What of for people that have receipts?
People that have it, okay, that's that is a harsh truth. A harsh. I don't think there's any way to go around it. The truth is that getting a receipt in medical school can be brutal, depending on the school. Okay, I've seen schools where they usually don't start immediately. They give them time before the next class starts. For uniports, as you're finishing your exams, you're starting school that same week, or maybe they will just give you the weekend and then you start the following week. So that kind of system, it doesn't give the receipt students time to prepare for their receipts, because having a receipt, you're not fully in the new class. So people that have receipts, I would still advise that you channel your energy to what matters the most, which is not the new class. It's your receipt exams. Unless maybe you have a test in the beginning of the class, you can happen. Please focus on your receipt exams so that you know that you're done with it. You will fall behind, but what that falling behind is not permanent. you can catch up. Just like you have to put in more work now. You need to double your pace when you now eventually pass your sit exams and join the new class.
So the last question says that if you could go back to your first year of medical school, what would you do differently to achieve academic excellence?
Okay. Um, if I could go back to my first year of medical school, I think first off, I would start doing my passations early on. Very important. I could do medical school again. I wouldn't just focus on it, but just reading, watching videos and all. And I would also try and do past questions. Once you just get into a class, even before knowing the courses that you're doing in that class, just find past questions. Look at it. You don't need to know the course content. You're doing O&G pediatrics. You just, as you enter the class, please, where are the O&G past questions? You bring it, look at it. Obviously, you may not be able to answer the questions then, but then in that moment, your brain has registered something. So, okay, they ask this, they ask that. When you eventually start reading, your brain takes note of those questions that were asked. So I would do my first was early on. And then the second thing, if I could go back, I think I wouldn't beat myself up too much. I would just push it, definitely push myself so that I don't have any regrets. But then don't beat yourself up too much because like I said, there are times when you would work hard towards something, but then anything can take place, anything can happen. You may not get the distinction you want. A lot of things, we usually, when we advise younger colleagues, we usually focus on what they should do. Read this, revise, active recall, do this material, look at this past question. But then we forget that a lot of things outside our control can have so much impact on the outcome of our results. So you could fall sick. That's one. That's where you have to pray. For things outside your control, you pray, hand them into the hands of God, and then do your best. Things within your control, try and do your best. Don't leave any stone unturned.
What's your advice to anyone that is watching this video?
Okay, so anyone watching this video now, don't second guess yourself. Go all out. If you desire to have a distinction, if you desire to stand out academically, people doing it are no different from you. Okay, you have so many resources at your fingertips now. I think this is the best age to learn anything as an individual. You have video resources which are super good. You have lectures for almost every course. In fact, for every course, let me not say almost. You have lectures for every course. You have books, different textbooks, from summaries to very detailed books. You have access to all of them. You don't need to spend money in getting an actual hard copy. Then to go to a library to sign out a book. It's all on your phone. It's all on your laptop. You have everything you need to excel as a student. People doing it, people having distinctions, people finding cures to diseases, breaking frontiers are no different from you. Trust me, there's nothing different. And pray, hand everything into the hands of God, and then do your best. Give Him more than enough for Him to bless. Then you excel.
So we finally come to the end of this video. Thanks for watching. Don't forget to, if the video was helpful, don't forget to like, share, comment, and subscribe. So do you have anything you want to say? Any final thing?
Yes, please like and subscribe. Thank you so much for having me. It was a